It's being called one of the most important speeches of his young presidency. Tonight, President Obama will try and rally a very divided Congress to pass health care reform. And it isn't just Republicans who stand in his way. It's also members of his own party. CBS News Chief White House Correspondent Chip Reid has the latest. Good morning, Chip.
Well, good morning, Maggie. The president has been criticized by Republicans and Democrats alike for not being enough of a leader on health care reform, by adding to the confusion by not saying exactly what it is he wants in this health care reform package. Well, tonight, he hopes to fix that.
The president needs to do is clarify, again, what's specifically in it for the public.
But the president also has to unify Democrats. Senate Majority Leader Harry Reid and House Speaker Nancy Pelosi have endorsed the public option.
I believe that a public option will be essential to our passing a bill in the House of Representatives.
But Senator Reid doesn't have the 60 votes needed in the Senate to get it passed, and Speaker Pelosi will have difficulty with moderate and conservative Democrats in the House. Senator Max Baucus, chair of the Finance Committee, says the only chance of a bipartisan bill will leave the public option out. Instead, the $900 billion Baucus plan would offer privately owned cooperatives and charge insurers, drug companies, and other health service providers fees to cover the costs. It would also require all Americans to purchase insurance, with maximum fines up to $950 for individuals and $3,800 for families above the poverty level who don't. CBS News will bring you live coverage of the president's address and the Republican response this evening, starting at 8 p.m. Eastern Time. Maggie?
CBS's Chip Reid. Thank you, Chip. Joining us now is White House Press Secretary Robert Gibbs. Good morning, Mr. Gibbs.
Good morning. How are you?
I'm fine, thank you. The president has made countless speeches on this topic already, and a CBS News poll finds that most Americans still don't understand what his plan would mean for them. The Republican Senator Mitch McConnell said that it should be clear by now that the problem is not the sales pitch, it's the product. Is the president willing to accept or even consider the possibility that's true?
Well, look, what we're going to do tonight is the president's going to speak clearly and directly to the American people about what is in this bill for them. It will provide safety and security for millions of Americans that are fortunate enough to have health care, and provide access to affordable health care coverage for the millions who don't. It will talk about cutting costs for families, small businesses, and government. And I think that's what we'll lay out tonight.
The president has continued to express his support for this public option that would compete with private insurance, but I could give you a list of both Republicans and Democrats who either are not for it or are very willing and happy to drop it. Would the president tonight go on and say, I know the only chance of this happening is if this public option is off the table, so that's my compromise. The public option is off the table. Let's move forward.
No, the president tonight will talk about the public option and talk about the need for choice and competition. We have insurance markets that are dominated by just one insurance company. And for those that are in the private insurance market or seeking small business insurance through the private insurance market, there's nobody to compete with one healthcare insurance company that dominates that market. There's no choice, there's no competition. Those are exactly the things that we have to see in healthcare reform, and the president will talk about that tonight. Maggie, you used your poll in your first question. The public option is something that's supported by a majority of people in this country.
Is the president willing to budge on this public option? Would he go as far as vetoing something that lands on his desk without it?
Well, again, what the president is going to look for is does the legislation that he thinks will get to his desk this year to reform our healthcare system, does that bill provide adequate choice and competition for millions of Americans who are looking for private health insurance on the private insurance market? We can't have health care reform if an insurance market is dominated by just one company.
And Rahm Emanuel said that the inability to act here would mean political consequences. If health care reform doesn't get done, what do you think the consequences will be for the president?
Well, I think the political consequences are for both parties. Mitch McConnell has come back from Kentucky. Mike Pence has come back from Indiana, and both said in the last few days that they've heard from their constituents and we have to get something done on health care. We have struggled with the high cost of health care for decades. Something has to be done about it, and this president is determined to address this issue this year.
Robert Gibbs, thank you so much.